Pozdravujeme všetkých našich poslucháčov a divákov. Na úvod opäť jedna prosba. Tieto podcasty sú otvorené úplne pre všetkých a sú bezplatné. Prosíme vás teda o vašu podporu a do konca mesiaca je naše predplatné so zľavou 50% s kódom Ozdravme 2024. Jedna veľká zmena v tomto podcaste a ospravedlňujeme sa tým, ktorí nemajú až tak dobrú angličtinu. Neverím, že ju mám. A dnešný celý podcast bude v angličtine a hádam sa nám podarí doplniť aj titulky. So I'm switching to English now. With me is Michael Cannon from the Cato Institute, and we will be talking about many things, but the prior topic is of course healthcare. But since you're here and you're from the United States and the U.S. Presidential elections are coming, so the main concern of many people in Europe is Trump going to win?
The problem with elections is that someone always wins.
Yeah.
And the amazing thing about the Democratic Party in the United States is that they keep picking candidates who make Donald Trump look not reasonable, not better by comparison, but who a lot of American voters think make Donald Trump look good by comparison. And, you know, Joe Biden beat Donald Trump soundly in 2020. But it's not clear that he's going to be able to do that this time around for various reasons. And so, I don't have a prediction, but it is just remarkable to me how poor the choices are for president in the United States.
Many Republicans that I know, they are also never Trumpers. And the reason why they told me that they voted for Joe Biden was because he's not Donald Trump.
And that's a very reasonable case. I mean, between Trump and Biden, only one of them has tried to overturn a U.S. election.
Yeah.
This doesn't mean that I am any fan of Joe Biden, but Donald Trump does appear to pose a unique threat to democracy, to the constitutional order, and it is it's scary as a U.S. citizen and someone who believes in individual liberty and the rule of law, that someone like Donald Trump could get any traction at all in the U.S. political system. And if you want to know how libertarians approach Donald Trump, I recommend an op-ed in the Washington Post that my boss, our president and CEO at the Cato Institute, Peter Gettler, wrote on the occasion of Donald Trump addressing the Libertarian Party of the United States. The Libertarian Party, which is not a Libertarian Party anymore.
It used to be Gary Johnson's party, right? If I remember correctly.
It did, and there have always been these factions that are what you might call alt-right and think that they're libertarian, and one of those factions took over the party.
So it's alt-right now?
And said things like the Libertarian Party should be open to bigots because we can't really decide what a bigot is. And so there's nothing libertarian about this approach to humanity, to politics, to public policy. This organization, I might agree with some members of the Libertarian Party leadership on some issues, but on that fundamental issue of the equal rights and dignity for all, we appear not to agree. And so this is not a Libertarian Party. And what what our president and CEO explained was that Trump is not a libertarian, that party is not a libertarian.
It's definitely a libertarian.
We believe in individual liberty and the equal dignity of all human beings, as well as the rule of law. And Donald Trump appears to want to dispense with that in any number of ways, not just by ignoring or trying to overturn the clear results of an election, but also by trying to, I won't get into the long list of ways that he's tried to subvert the rule of law, but I'll just return to what I said before, which is I wish we had better choices.
That would be my wish for you as well. But let's turn into next topic and the main topic, which is healthcare. Yesterday, I attended your lecture, which was organized by Ines and Martin Wachinski, who is sitting in the backstage. So thanks to Ines for bringing you in, and thank you for coming.
They have
also,
been wonderful. Thank you for having me.
Yeah, my pleasure. There are a lot of myths in Slovak healthcare, but once I was listening to your speech, I found out that we are maybe similar also in a way, Slovakia and the United States. There are also a lot of myths in the United States. So if you could shortly explain or briefly, if it is possible, how does the United States healthcare works and what are the differences, the main differences between maybe European healthcare system? They are diverse, comparing with the United States healthcare system.
So I think the greatest trick that advocates of socialized medicine ever played was to convince the world that the United States does not have it. The United States not only has socialized medicine, it has every variety of socialized medicine that you will find elsewhere in the world, and maybe one or two that no one else has invented, that we've innovated in the area of socializing medicine. So most of the American population, the U.S. population, has health insurance through an employer, much like compulsory health insurance through an employer, much like the German system. About a sixth of the or about 70 million people have health insurance through a Canadian-style government program, which we call Medicaid, where the national government sends money to the states and then they run programs. It's ostensibly just for the poor, so it's not the entire population like in Canada, but the structure of the program is very similar. Another 60 or 70 million people have health insurance through, well, let me get back to that 60 or 70 million. We also have our own version of the British National Health Service. It covers about 1% of the U.S. population that are veterans of the U.S. military. It is what we call a fully integrated system where the government plays the role of and the insurer, as well as it owns the hospitals, it employs the doctors and so forth. So they all work for the same entity, much like the British National Health Service. There's nothing inherently socialist about that model. We also have a private sector version of that in the United States. We may get to that. But we also have healthcare markets like the Swiss and markets in Switzerland and in the Netherlands that some people call managed competition. In the United States, we call it Obamacare, where you have some measure of competition between heavily regulated and heavily subsidized private insurers. That covers about 10 to 20 million people. But where we've innovated is with the U.S. Medicare program that covers about 60 to 70 million. I mentioned this group before. This is a totally government-run system where the national government provides health insurance to 66 million people, sets the prices for billions of transactions across this massive market, and writes checks directly to doctors and hospitals. There is no country in the world, no insurance scheme in the world that can match the Medicare program in terms of size and scope. Especially if you measure in terms of the dollars spent. Medicare is the largest purchaser of medical services in the world, even though it only covers a fraction of the United States population. And yet within the Medicare program, we also have a version of managed competition, not unlike what you have here in Slovakia, where private insurers compete against a government-run plan. And then we have some people who are in both the U.S. version of the Canadian system and the Medicare program who get coverage from both. That's also unique on this planet. And then we do have about 8% of the population who have no health insurance. Now,
so the health insurance is not mandatory. You can decide if you want to have one, but you also have a possibility not to have health insurance plan at all.
Well, it is mandatory.
It is.
First of all, it's mandatory that you pay your taxes to support all these government schemes.
Got it.
Whether you enroll in health insurance or not is also mandatory. If you are a taxpayer, if you earn any income at all, then there is an implicit penalty. The government doesn't call it a penalty, but there is an implicit penalty if you take that money and don't buy health insurance with your earnings. The government creates...
We are forced to buy some sort of the health insurance only by the fact that you are employed or you are employer, right?
Yes, because if your employer, the way it works is if your employer gives you $1 of income in the form of cash, well, if $1 of income in the form of health insurance, let's start there, there are no taxes on that expenditure. You have to let your employer control that money and let them choose your health plan. but you don't pay taxes on that compensation. If your employer takes that same dollar and gives it to you as cash, then on average you have to pay a marginal tax rate of 33%. Now that's just income taxes and payroll taxes, and so we don't label that 33% a penalty for not purchasing insurance, but economically, functionally, it is identical to a penalty for not purchasing health insurance. So that's what makes it mandatory. As mandatory, it's even more compulsory than the explicit mandate that Obamacare enacted and that Congress effectively repealed. And so the uninsured, if they're earning income, are paying that penalty. They're paying higher taxes than the people who are enrolling in employer-sponsored insurance.
But there is still a possibility just to refuse to have a health insurance. But the penalty for it is you're paying higher taxes.
Yes, much like in other countries, if you pay the penalty, then you can go without health insurance.
I'm not sure if in Slovakia it is even possible not to have a health insurance unless you give up on your permits to, it's sort of a permit that you are actively living in Slovakia. Then you have to have a health insurance unless you
different countries go about it in different ways. In the United States, you not only have to pay that 33% penalty, you might have to pay an even larger one because if your employer offers you health insurance, that employer is typically spending $5,000 to $7,000 of your compensation on that health insurance and won't give it to you. If you decline the health insurance, they won't give it to you as cash because the tax laws basically forbid it. And so you're paying more than a 33% penalty. You're paying a 100% penalty on that amount. And that is, again, the functional equivalent of a mandate to purchase health insurance. If you did not, if they gave you that cash and you refused to pay the 33% implicit penalty, then there would not only be, then the government would come after you with additional fines and potentially jail time. So you can refuse to enroll in health insurance, and if you pay the penalty, then the government will leave you alone. But if you refuse to pay the penalty, the government will come after you.
How does health insurance in the United States generally works? What does it cover? How are people deciding which insurance plan they are going to choose or which insurance company are they going to become the client of, etc.?
So most of the population does not have a choice. The employer chooses for them. And even if the employer offers multiple health insurance plans, it's usually the high and low option from a single insurer. So most people who have employer-sponsored insurance, and that's most of the U.S. population, don't have a choice between competing insurers.
Why?
Because that's very expensive for employers to administer. And this what you can call a tax preference for employer-sponsored insurance or a tax penalty on people who want to choose their insurance themselves came about by accident. No one in the national government decided, hey, let's create a tax break or an implicit penalty on a tax break for employer-sponsored insurance or an implicit penalty on health insurance choice back when this penalty took effect in the early part of the 20th century. There wasn't even health insurance in 1913 when Congress created the income tax, or in the 1920s when the Treasury bureaucrats decided to create this tax preference. It just sort of emerged and then grew over time, and people came to accept the idea of employer-sponsored insurance, even though it is terrible, low-quality insurance. And now people are so dependent on it. The healthcare sector is so dependent on it. Large employers benefit from it so much because it helps them compete against their smaller competitors in the labor market that no one in the healthcare industry and very few employers want to change it. And that is why we have so little choice. Now, if you look at other parts of the health insurance marketplace, if you look at Obamacare, which sort of regulated a market that was already there. In that market that was already there, covered 10, 20 million people, you had considerable choice. The consumer could choose their insurance company. They had a lot of choices among insurance plans that covered varying types of services and with varying levels of deductibles and other cost sharing on the part of the enrollee. So you had considerable choice there. And in that small corner of the U.S. health sector, we saw remarkable innovations that made health insurance more secure for the sick than employer-sponsored insurances. And that even began filling in the cracks of the employer-sponsored system, because one of the features of employer-sponsored insurance is you lose it when you change jobs. And that often happens after people get sick. And so people would lose their health insurance because the plant closed, or because they moved to another town, or their employer just stopped dropping coverage, or they divorced, or their spouse died, or they retired. And then the conditions, the medical conditions that they had developed, which should have been which should have continued to be insured conditions, became uninsured and uninsurable pre-existing conditions. Mm-hmm. So that's what I mean when I say that employer-sponsored insurance is terrible insurance. The government decided to compel people to enroll in terrible insurance because it exacerbates the problem of pre-existing conditions where people are already sick and then need to go buy a new health insurance plan.
So what happens, you lose your job, or you get divorced, et cetera, or you get retired? Because once you are retired, you do not have employer. You are not employed anymore. So does those people have insurance, or they are paying it by themselves?
When Congress created the Medicare program for elderly people in 1965, Medicare provides health insurance. That's 66 million people. It provides health insurance to 99% of the eligible elderly population. It did that.
So the government is paying for it?
The government is paying for it. It did that because for 40 years, the government had been penalizing cradle-to-grave health insurance that you could buy from an insurance company. When Congress enacted the Medicare program in 1965, there were 70-some private insurance companies who would provide coverage that would cover you until death, into retirement until death. But the problem was the government had been penalizing them. So
for what reason?
It was that historical accident that I mentioned. The government created the income tax, and in implementing it, they decided to exempt or exclude employer-sponsored health insurance from taxation, and that created that implicit but very real penalty that I talked about that discouraged people that penalized people if they took that compensation as cash and used it to buy coverage that stayed with them between jobs, that let them pay healthy person premiums all the way into retirement, no matter how sick they got. And so this problem that we have in the United States of pre-existing conditions where people would lose their coverage and not be able to afford it anymore was a problem that the government either entirely created or vastly exacerbated. And that small market of 10 to 20 million people was solving that problem. It was not only providing that cradle-to-grave coverage that I mentioned, but it was also filling in the gaps of employer-sponsored insurance so that when you lost your employer-sponsored insurance, you weren't left uninsured. But in 2020 or 2014, Obamacare outlawed all of those innovations and reformed that market. So now we have a Swiss or Dutch-style market.
You would have to explain what the Obamacare is, because we heard about it a lot, but it's 10 years ago, so a lot of people doesn't remember or don't know anymore.
Obamacare was a 1,000-page law with lots and lots of provisions in it. But the two main things that it did to expand health insurance was to transform that market from a reasonably free market that was innovating and making health insurance more secure than it was before, or more secure than employer-sponsored insurance. Obamacare outlawed all of that and began to regulate that market heavily by requiring people to purchase coverage they didn't want, by imposing price.
It became mandatory.
Well, yes, it included a mandate that required people to buy some form of insurance. It imposed price controls on health insurance plans that penalize insurers if they provide quality care to the sick. Again, these are not explicit penalties. These are implicit penalties, but they are very real as well. They exist here in Slovakia, where you have price regulation. And the government created a risk equalization program to try to eliminate those penalties, and it's not really working. They still exist. And so So that was one large coverage expansion in Obamacare. The other one was the expansion of that Canadian-style program in the United States, the Medicaid program, where now 40 out of 50 states have implemented that part of Obamacare. And so when I'm talking about Obamacare and its effect on private insurance, what I'm mostly talking about is its imposition of a Swiss or Dutch-style health insurance scheme or health insurance regulatory scheme in that 10% of the U.S. market for private health insurance.
And one of the statements, I think it was in Washington Post, that you are the person who could take down the Obamacare, as far as I remember.
So that was Vox had that headline,
Okay.
and it was a very flattering headline, and I appreciated them for that. They were referring to work that I did, showing that Congress allowed states and intended to allow states to block certain parts of Obamacare. I mentioned that it imposed this Swiss or Dutch style system on the private individual market in the United States. Part of that system is regulation, but also heavy subsidies to help people afford the very expensive regulations that the law imposed. And Congress actually gave states the power to block those regulations and intended to do so. To block, I'm sorry, not to block those regulations, to block those subsidies, to block the subsidies, all of the subsidies. And it was very clear in the legislation. The Supreme Court, there's a case that litigated this question. It went all the way to the Supreme Court. The Supreme Court said, yeah, that's what the law says, but we're going to do something else anyway. So because of the role I played in encouraging states to block those parts of Obamacare and doing the legal research to show that, yes, that's what the law says and that's what Congress intended, that enabled the Supreme Court case to happen. That's why Vox said that I am the man who could take down Obamacare. But the Supreme Court broke with what the law says, and they even admitted that they broke with what the law says, which was a terrible travesty that I will probably never get over. But it was a very flattering headline that I got from Vox.
Definitely. If you have to explain or demonstrate some another myths that people in Europe know or doesn't know about the healthcare system in the United States, what would you emphasize on?
Sure. So the biggest one we've already touched on is that the U.S. health sector is a free market. It's not remotely free, as our prior discussion explained. We have every form of socialized medicine in the United States that anyone has ever invented, and some that no other nation has adopted. And for further proof that the U.S. health sector is not a free market, we can look to the OECD. They collect data, lots and lots of data on all advanced nations' health systems. And the one metric that they publish that gets the least amount of attention, I think, but deserves the most attention, is what share of health spending in each country is voluntary versus compulsory. So voluntary meaning the government doesn't push you one way or another. You have free choice between this option, that option, between spending on healthcare, whether and how you spend that money on healthcare. Versus how much of a nation's health spending is compulsory. In other words, either the government taxes that money and spends it itself, and those taxes are compulsory, or private spending that the government where the government penalizes you if you don't spend it the way the government wants. The OECD finds that not only does the United States have a very high share of its health spending that is compulsory, it is among the highest shares in the OECD. 85% of health spending in the United States is compulsory. That is just 2 percentage points behind the highest share in the OECD, which is Germany at 87%. And the United States at 85% is in a statistical tie with France, Czechia, Denmark, and Norway. These are all nations that most people would agree have a socialized system. And the OECD is saying that government has as much control over health spending in the United States as government does in France, Czechia, Denmark, and Norway. And the United States, or government in the United States, controls more health spending than governments in the United Kingdom, where it controls 81%, and Canada, which is somewhere in the 70s. And these are nations where they have explicitly fully socialized systems of different varieties, but where the systems are not only fully socialized, but there's no cost sharing or vanishingly small levels of cost sharing. And yet government still controls a larger share of health spending in the United States than in these fully socialized countries. So that should completely shatter the myth that the U.S. has a free market in healthcare.
As far as I know, and as far as I remember from your lecture, is that United States is spending around 16 or 70% of GDP on healthcare. Is that correct?
About 16.6, yes.
16.6. But you're spending really a lot of money on healthcare.
Which is vastly more than any other nation.
But is it efficient system? Is it effective system?
So it's really hard to know. I think it's important to note that 14 percentage points of that 16.6%, so 14% of U.S. GDP is compulsory health spending, where the government will penalize taxpayers if they don't spend their money on healthcare. 14% of GDP is a larger share of GDP than any other nation spends on healthcare in total, voluntary and compulsory combined. So if you want to know why does the U.S. spend so much more than other nations on healthcare, it's as a share of GDP, it's because our government compels us to do so. Is it efficient to spend that much money? Probably not, but it's really hard to tell. If you look at the evidence, there's lots of evidence that the U.S. health sector is wasting vast amounts of money. So look at the U.S. Medicare program. The best research available suggests that this $1 trillion program spends about $300 billion every year on medical services, goods and services that don't do anything to improve the patient's health and don't do anything to make the patient any happier, any more satisfied with the medical care they receive. That means it is pure waste. It is just a transfer from taxpayers to doctors and hospitals and pharmaceutical companies that don't do anything to benefit the patient along the way. So that is incredibly inefficient, and there are lots of other inefficiencies in the U.S. health sector. At the same time, one of the maybe two things the U.S. health sector has going for it is that we are an engine of innovation. We develop more new tests, new treatments, and cures than any other nation, and by some measures, by all other nations, more than all other nations combined. One of those is, for example, a cure for hepatitis C, a drug called sofosbuvir or Sovaldi. Sovaldi cures 95% or more of the people, of the hepatitis C patients who take it. It reduces all-cause mortality among hepatitis C patients by 50%. It is saving lives, but it's not saving lives just in the United States. It's also saving lives around the world. And so if you want to measure the efficiency of the U.S. health sector, you have to look at all of the inefficiencies that we can document, that we know exist within the U.S. health sector. But you also have to measure the efficiencies that we're generating in the terms of new medical innovations that save lives here and save lives abroad. Because right now, in most international comparisons, we're crediting the NHS, we're crediting the Slovak system with the efficiencies of Sovaldi that is saving lives. Those belong to the United States. I have not seen anyone try to capture and credit to the originating nation all of the efficiencies from the medical innovations that they develop, and that's an overview of why it's so difficult to answer the question of, is the U.S. health sector inefficient? It probably could be more efficient, but a lot of people don't credit it with all of the efficiencies that it does generate.
You say that basically by the development, you're also subsidizing the world by the new treatment and new drugs.
And the ridiculously high prices that we pay in the United States for pharmaceuticals is an implicit subsidy, not just of for patients in other nations, but taxpayers and government-run health systems in other nations. It is the contribution that the United States consumers and taxpayers make to socialized medicine in other countries.
Yeah, it's a little bit similar also with the army industry, because the United States is protecting Europe and saving Europe as a few times in a decade.
Sort of a similar dynamic in both places. Yeah.
It is. Also, during your lecture, you've been advocating that one of the problem of the U.S. health market is not that it is free, but the opposition, that there are too many regulations. You've been also showing the charts regarding the lobbying groups, and the lobby group in the healthcare was like 4 times bigger than the army lobbying. So, and you've been mentioning that a lot of healthcare companies or insurance companies, etc., are fighting against free market, not advocating it, because they are benefiting from it. Was it correct?
So the national government in the United States requires people who lobby Congress, the national legislature, to report how much money they are spending lobbying Congress. Mm-hmm. And for the past 20 years or more, the one industry that has outspent every other industry, usually by far, on lobbying Congress is healthcare. It spends 6 times the amount that the defense industry spends lobbying healthcare. And remember, the defense industry enriches a lot of defense contractors. They want an expansive U.S. military. They want an adventurous, interventionist U.S. foreign policy. They spend lots and lots of money, $200 million per year, or almost, in, it's not 200 million, it's like 136 in 2023, to encourage Congress to increase spending on the U.S. military. The health sector of the economy spends 6 times as much as the defense industry does. And the pharmaceutical sector alone spends about 2.7 times as much as the defense industry does lobbying Congress. Now, this is a puzzle. If the U.S. has a free market in healthcare, why does the healthcare industry spend so much money lobbying Congress? Is it because we have a free market and they want to keep it a free market?
Vice versa.
Probably not. What that indicates is that the government already has so much control over the health sector that the industry wants to capture those powers that the government has and use those powers to their benefit. And they do it very well. They fight against cuts in the Medicare program or other government subsidies. They fight to install or preserve regulations that enrich incumbent hospitals and doctors and health insurance companies at the expense of new entrants into the market, and they do it very well because those and they also lobby to protect the tax policies that we were describing before that penalize you unless you spend your money on health insurance and healthcare. And they've been very good over the decades at protecting all of these government interventions and blocking cuts. So good that when Congress passed Obamacare in 2020, over the first 10 years of full operation, the projections were that law would spend $2 trillion in new government subsidies for healthcare. They paid for half of it with tax increases, so $1 trillion in tax increases, but they paid for the other half by reducing the rate of growth of Medicare spending, okay? Medicare is that incredibly inefficient program that wastes 1/3 of its budget, so there's plenty of room to cut. They didn't cut anywhere near 1/3 of Medicare spending. But the only way they were able to overcome industry opposition to that $1 trillion worth of cuts was by promising the industry $2 trillion of new subsidies. So that is how entrenched the healthcare industry is, that the only way Congress can wring just a little bit of efficiency out of the Medicare program is by creating even more efficiency and subsidizing an inefficient health sector even more.
What would have to happen in order to have less expensive healthcare in the United States? Because we've heard about the stories, for example, insulin. for the diabetes, that is much more expensive in the United States than in Canada, and not even comparing with the European countries. So which steps has to be taken in order to get healthcare to be maybe more affordable, or if not more affordable, then in a better quality for the citizens?
There are lots and lots of things that state governments and the national government in the United States do that increase healthcare prices. Regulatory policies, tax policies, government subsidies that all drive prices higher, and that's what the industry is trying to protect with all of that lobbying expenditure, their high prices. So if you want to get those prices down, you need to change a lot of regulations and a lot of tax policies.
Change or cancel?
I would prefer cancel. That's my idea of change, because these regulations were never needed. They reduce the quality of care. They increase prices. We should get rid of them.
Can we say that in general regulations makes healthcare in the United States less affordable and more expensive?
Yes, clearly so. If you look at Obamacare's premium regulations for health insurance, they cause health insurance premiums to skyrocket, double or triple for many people. Or if you look at a part of Obamacare that requires people to buy 100% coverage for prescription contraceptives, that law takes away your freedom to choose a different health plan that doesn't cover them or has cost sharing. And prior to that mandate taking effect, prices for prescription contraceptives were falling relative to inflation. But when it took effect, those prices skyrocketed because the manufacturers of those products knew that their customers would no longer switch to a less competitive or a less expensive product, and that they had the insurance companies over a barrel. And so they just raised their prices. So regulations clearly increase prices. Tax policy, the penalties on controlling your own health insurance dollars and decisions, those increase prices, and government subsidies increase prices. So there are two main ways, two types of policy changes that you need to make in the United States to get prices down. And the most important one, I would argue by far, is to change who controls the spending so that it's not government and employers controlling 85% of that spending, but that the consumer controls that spending. And you can still subsidize poor people and sick people to make sure they have enough. In fact, my proposal to reform the U.S. Medicare program is the same as my proposal to reform the Slovak health system, which is take the money that the government was giving to the insurance companies, where it's giving insurance companies a higher payment to cover sick people, and just give that money to the patient, let them choose their health insurance plan. They will be price conscious in a way that they are not in the United States now or in Slovakia. They will demand price reductions, and they will spark price competition from producers. And we've seen, economic theory predicts, and there's lots of empirical evidence that shows that consumers cut back on wasteful care, and they demand lower prices, and they get lower prices when they see the savings, when they are price sensitive. That is the most important thing we can do to get prices down, and getting prices down is the most important thing we can do to make healthcare universal. If you want a universal system, you need markets to drive prices down, because that is how you bring healthcare within the reach of people who could not afford it yesterday, and that is how you make it easier for the rest of us to afford providing healthcare to the smaller number and ever shrinking number of people who still can't afford it. So that's one set of reforms, but that also helps with the other set, is more important than the other set because it helps to solve the other set of reforms. Once consumers control the money and they see in the checks they're writing to the insurance companies the effects of the regulations that drive up their insurance premiums, once they see the effects of regulations that drive up prices for contraceptives or other items, they will vote to demand that the legislature eliminate those regulations that are increasing prices. If those regulations are increasing their tax burden, then those costs, those higher prices are much less salient. If we make them salient to consumers, then they will not only be smarter consumers, they'll be smarter voters, and they will vote to eliminate those unnecessary
So basically, you're telling that
regulations.
the health insurance is too important to be run by the government.
It is too important to be run by government, and just as price controls are dangerous in every sector of the economy, they are especially dangerous in healthcare and health insurance, because when price controls erode the quality of medical care, and that's what Slovakia's price controls on health insurance are doing right now. The consequence is not that you go without some luxury that you would otherwise be able to afford, or you suffer a slightly lower quality of life. You may lose your life because the government is penalizing insurers who provide you quality health insurance and medical care.
Michael, thank you for coming.
It was a pleasure. Thank you for having me.
Thank you.